Good morning, you're listening to COVID-19 updates on the 26th of June on The Wire. India recorded the highest spike in the number of cases for the second day in a row. Just under 17,000 new cases were reported yesterday. Today, more than 17,500 people have contracted the virus in the last 24 hours. With this, the total number of cases in India is just under 5 lakh. It stands at around 4.9 lakh. More than 2.8 lakh people have recovered and more than 15,000 people have died. Across the world, there have been over 94 lakh confirmed cases. According to Johns Hopkins University, the global death toll due to COVID-19 stands at 4,82,000. 12 army personnel have tested positive for the virus in Nagaland's Kohima district. A group of army personnel had returned to Jakhama garrison from different parts of the country last week. According to a report published in the Indian Express, the Assam government has started a mental health support group program for COVID patients and quarantined persons in the state to provide emotional support, counseling, and treatment. The Kerala Health Minister has also announced that the government is taking measures to strengthen counseling services for people who are under stress due to COVID-19. The Advertising Standards Council of India said that it found 50 campaigns by Ayurvedic and homeopathic drug makers offering cure for COVID-19 in April alone. They said that they had flagged these ads to the union government for action. These advertisements were across media platforms and were found to be violating Ministry of Ayush's order dated the 1st of April. The order dated 1st of April prohibits publicity and advertisements of Ayush-related claims. The disclosure of the Advertisement Council from April comes a day after the government issued a gag order against Baba Ramdev's company Patanjali Ayurved for advertising a drug as COVID-19 cure within hours of him launching it. The advertising body said that Ayush Ministry had sought its help to alert them about such advertisements and that it launched a drive to act against misleading advertisements claiming prevention or cure for COVID-19. India is gearing up to install artificial intelligence-based COVID surveillance cameras that detect body temperatures of individuals and whether a person is wearing a mask or not. According to a report in the Indian Express, first off the block is Indian Railways. The Indian Railways have called for tenders to purchase the system for railway stations and other places which are expected to see significant footfall. A few railway zones have already concluded the purchase. According to a recent UNICEF report, the ongoing COVID-19 pandemic has placed the lives of millions of children in South Asia at risk. Quoting a study conducted by Johns Hopkins Bloomberg School of Public Health, the report warned that as many as 881,000 children aged 5 and under could die over the next 12 months. A bulk of these deaths are likely to occur in India and Pakistan, the report said. India's Hetero Labs Limited has priced its generic version of Remdesivir drug at 5,400 rupees per 100 milligram vial. Remdesivir is an experimental COVID-19 drug produced by Gilead Sciences. Hetero Labs Limited, which is a privately held company, said that it would supply 20,000 vials of the drug across the country. Fellow Indian drug firm Cipla Limited earlier this week said that its own version of the antiviral drug Remdesivir would be priced below 5,000 rupees. Cipla and Hetero are among drug makers which have licensing agreements with US-based Gilead Sciences. The license allows both the companies to make and sell the drug in 127 low and middle-income countries. Remdesivir was the first drug to show improvement in trials on COVID-19 patients and has won the approval for emergency use in severely ill patients in the United States, Korea, and now in India. Thank you for tuning in. Keep reading and watching The Wire and The Wire Science. We will see you tomorrow. Until then, stay safe.